Hello friends, today we are back with another topic, and this topic is migraine and headaches. Why is this important? Because migraine and headaches are very common. They affect a lot of people, both men and women. Unfortunately, young people are more affected. So if you look at the age group, typically it occurs in people who are say 15 to 45 years age group, and as you can understand, that is the most productive age group, because that is when people have to study hard, then get into the jobs. So it adversely impacts all these activities. And if you look at the most common cause for headache, and that is migraine. So just a few words about migraine first. So migraine is more common in women, and it is more common in women from the time of menarche, that is when the periods begin, and till menopause. So this makes us believe that there could be hormonal basis. And one more reason to suspect hormonal basis is that many women with migraine, they have worsening of headaches just before their periods. So 1 or 2 days before periods, and then during the first 1 or 2 or 3 days of the periods, they have increased severity of migraines or headaches. Now, what are these migraines? How do we diagnose? So the best news about diagnosis is that it doesn't need any blood test. There is no need for doing any brain scan. With the help of symptoms, we can come to a diagnosis. So what are the classical or the most common symptoms of migraine? Of course, there has to be headache. Typical migraines, they have headaches on only one side, either left side or right side. But common migraines, it can affect the entire head. The pain can be in the front of the head, the sides, back of head, and sometimes even the shoulders. And it can be in the face also, sometimes eyes, behind the eyes. So all these parts can be affected. The second important point is that the type of headache. So many people describe the headache as throbbing type, pulsating type, or squeezing. It is very severe headache because it incapacitates the person. The person is not able to engage in any routine work or studies. They just need to lie down or take rest to get relief from the headaches. So it is a severe type of headache, and the headache typically lasts for more than 4 hours. So if someone has a headache which stops on its own without any medication in 30 minutes, then it may not be migraine. So migraine headaches go beyond 4 hours and up to 72 hours. So that is a typical duration of the headache episode of migraine. Along with headaches, there could be additional symptoms. What are they? So it can be nausea, that is feeling of vomiting, actual vomiting. Then there is a term called as photophobia. So they don't tolerate bright lights, that is photophobia. So any bright light or going to sunlight, even the noise, they don't like talking to people. Even if the music is very soothing, they don't enjoy the music. So they want to lie down in a very, very quiet room, peaceful surroundings, without talking to anyone, with lights completely switched off. And that is what gives them relief. So with this presence of these symptoms, one can diagnose migraine. So as you saw, it doesn't require any investigations. So today I have discussed about the main symptoms of migraine. Some types of migraine, they have another symptom called as aura. So aura is something which happens say 10 or 15 minutes before the actual headache begins. And the most common type of aura is called visual aura. In that, the person can have zigzag lines or sometimes flashes of light on one side or both sides. And then after 10-15 minutes on the same side, the headache begins, and then gradually it goes up. So that is called visual aura. Sometimes, rarely, people can also have tingling or numbness on one side, that is sensory aura. Sometimes some sounds can be heard, that is auditory aura. So this is migraine with aura is also one of the types of migraines. And few patients with migraine, they can have dizziness or vertigo, where they have a sense of rotation, and that is called as vestibular migraine or migraine associated with vertigo. So that is another thing to keep in mind. And some people with migraine, they can only have visual symptoms and no headaches at all. So these are some rare types of migraine you should keep in mind. And if you have any symptoms like this, consult a doctor. And then because people with migraine did not suffer, because there are excellent treatments for migraine available. and which I'll be discussing in my next video. So, but for now, I hope you have learned something about migraine symptoms, how common they are, and how we can diagnose. Thank you.